tell me everything about Evo.
I can't wait.
Yeah, I mean, just a little bit of context on that. For me, it's a modular simulator is the Holy Grail. It's like it covers all areas for diversity. It makes sure that you can go from male to female, age, etc., all that sort of stuff. So yeah, I'm really interested to understand the concept a little bit more and how it's going to change patient simulation.
I am thrilled to discuss this with you, Jake, and I want to look actually into our camera for a moment, right? So Jake and I, when we talk about Evo, get ready. It is the next generation of patient simulators at Elevate Healthcare. This is an ecosystem. It goes beyond simulators, and it is hardware, it is software, it is education, it is training, it is consulting. When we look at the ecosystem, it is a powerful tool. As we kind of pivot directly to Evo, Evo does allow flexibility, modularity, and efficiency. I want to kind of go through some of the features with you head to toe, if that's okay.
Have
you seen Evo yet?
I have. I played with it. We'll talk about that in a minute.
Oh, I can't wait. I can't wait for your feedback. So when we go head to toe at Evo, we do have the first thing often you'll notice is, wow, the skin looks realistic. You do notice the semis. We have had semis with some of our other products. But then you begin, as a clinician and as an educator and an instructor, you begin to touch and feel the product. And when you touch and feel the product, some of the first things people notice are the range of motion and the articulation of the neck. Whether you're looking at really teaching foundational skills such as assessment or NG tube, or more complex skills like intubation, Evo meets those needs. And as you keep going and you begin to immerse yourself in everything that Evo offers, you understand that there's voice modularity, right? So you can have a young voice, a middle-aged voice, an elderly voice that corresponds with what you want to input into our powerful software system, which is Maestro. Certainly the modularity of the limbs is fantastic, and it's so easy. What I love about the limbs and what I love about Evo in general is that as you touch the mannequin, listen and auscultate, take off the arms, it really gives you, on our avatar, on our screen, it's telling you what you're doing. If you're doing it right, if you're doing it not, it is your guide. It is really your best friend. In addition, all of the data is tracked in our powerful learning assessment tracker, and all of that data is exportable so you can understand what your learners are seeing, touching, doing, and really taking your education to the next level. Yeah,
I mean, I had a look at, I was with Tim yesterday.
Wonderful.
He showed me around it, and I have to say I was really impressed. One thing from my point of view, looking at patient simulators, and I've seen a lot of them in my time, was exactly that, the articulation, the way the jaw moves, the way the head moves.
That's right.
I thought it was fantastic. The skin feels really good as well. But the one thing that strikes me, and really because I wrote a proposal on it a few years ago on something very similar, was the use of CAN bus so you can change the arms and legs over.
Correct.
And now CAN bus has been used in the automotive industry for decades.
That's right.
And I've always struggled to understand why in patient simulation it wasn't brought into today. It seems like the most natural way to do it.
Absolutely.
And finally, you guys are doing it, and that's why I call it the Holy Grail,
I love
a modular simulator. So I'm really impressed.
I love that, Jake, and I think when you referred earlier, there was a little bit of quiet, right? Kind of before this energy and this push forward. That is because doing it right for our customers, for the patients, for the students, it's the right thing to do it right and not rush our products to market. In addition, when we talk about thought, there's also being in a war room together, making sure that every aspect of it, from the internal design to the external design to how our educators will go deliver the training, how our consultants will understand the evolving solutions and how Evo can respond. It's important to get this right. We know that. We're proud of what we're offering to the market. And I think the other thing that we know is that diversity is important, equity is important, but also respectful care is very important. So really drawing synergy to all of those elements has been part of this great process.